Welcome back to the number one breakfast show in the country, Morning at NTV. My name is Romeo Busiku, and of course, as usual, we are usually exalted to give you all the information you need to conquer your day, your week, or your careers. This conversation, take note, is sponsored by ITEL. If you haven't bought a product from ITEL, your girlfriend, I'm afraid, will be leaving you anytime soon. So please, do the needful. Go buy yourself an ITEL product. I have Honorable Sophia Jukonale, the chairperson of the Equal Opportunities Commission, and I want to expand more on the fact that the COVID-19 pandemic is wreaking havoc more on the people who are vulnerable. So what is government doing, and what interventions have been expedited in the interim to ensure, or the long term, to ensure that the vulnerable people within this country are protected from the negative impact of the COVID-19 pandemic? What is their plight to begin with? Honorable Sophia Juko Naole joins me right now. A very good morning.
Yes, thank you for hosting me.
It's a pleasure to have you here.
Yeah, this is my first time in your studios.
Indeed.
Yeah.
Would like to know what kind of work you're doing at the Equal Opportunities Commission and the organization itself. What is your mandate?
Okay, the Constitution, the Commission is a constitutional commission. It is established by an Act of Parliament, and basically, in a nutshell, we are destined to work towards realizing that everybody, every person, participates in society, whether marginalized, especially the marginalized persons, should actually be given room to participate and benefit from government programs. And where possible, affirmative action should be given. And as a commission, we are supposed to oversee the work of monitor, evaluate, to ensure that there is inclusivity in the development programs, so that nobody is left behind. Yes.
How would you scale government's intervention efforts during this COVID-19 pandemic on a scale of 1 to 10? Do you think government has done more to put in place interventions that go a long way in helping vulnerable people protect themselves from the shocks, vulnerabilities, and stress that this pandemic has brought about?
You know what I'm learning, and what is very interesting.
Indeed.
His Excellency appointed me to the task force, the national task force.
Indeed.
Actually, I have to thank him for appointing me to be the chairperson of the Equal Opportunities Commission, and also thank him for appointing my other colleagues.
Indeed.
But attending the last national task force on COVID, I saw the Minister of Gender coming up with a list of vulnerable people. Because, His Excellency, in his last address, he told us to focus on the vulnerable.
Yes.
In our country, we have a policy on who the vulnerable people are. And actually, these include people like person with disabilities like me, then women, youth, old people, orphans, those in hard-to-reach areas, and so on and so forth. But this time round, with the coming of COVID-19, there are people who have gone to the vulnerable category. People like, taxi drivers, those who are actually come in and work, and then they get a living that day. And if they don't work that day, they will not earn a what?
Hand to mouth.
Hand to mouth. So when I was speaking in the task force, I said, I'm learning. I think now, as much as we have a policy and a definition for vulnerable people, but I'm learning that vulnerability can be an evolving concept. Yeah, you may not be vulnerable today, but because of circumstances like COVID, then you become a vulnerable person.
Meaning some people who are not vulnerable in 2020 are now vulnerable in 2021 with this second lockdown.
They can be. And I was among the first people who wrote about vulnerability and the COVID-19. There are some facts which we know about the the pandemic. Like, the transmission itself. It is from one person to the other. If actually you stay at home, as, for example, the president is telling us in this lockdown, if you stay at home, there are high chances that you will not get the disease.
Indeed, and the numbers have reduced. At least we were registering 1,000 on a daily basis, and we are registering 700 to 800.
So, he was telling us, if we can remember the very, very first addresses by the president, he was talking about the facts about the virus. Then he was telling us about the preventative measures. Like, for example, that you don't sneeze in the public. You don't, sneeze in your hands. But you sneeze maybe in your ankle. Then he was telling us that the disease, if you don't touch your nose, You don't touch your mouth. But, you know, you be careful with that. You clean your hands with soap and water. You sanitize, and so on and so forth. But there are also other facts. For example, if somebody comes and touches this surface, they know there is a certain time the virus remains active. So the need for sanitization. But now, with vulnerability, a person like me, I move using appliances, like the crutch. I use crutches. The time, if somebody comes and touches my crutches who has the virus, the virus stays for some time. But then there's no way I have to use the crutches. Somebody who uses a wheelchair, you know, the virus can stay. And you know that person who uses a wheelchair has to have somebody who pushes him around.
So essentially, if you adhere to the preventive measures, you can be able to, or assured that you ward off the contraction of the COVID-19 disease. But then you might not survive the onset or the impact of the negative effects that are economic. Health-wise, you protect yourself, you not contract COVID-19. But what about the economic effects of this COVID-19 pandemic on our vulnerable people? Paint for us a picture of how they are struggling during this COVID-19 pandemic. Do you feel like more people have fallen into poverty?
Yes, I'm afraid before I answer that question, because now where we are as the Equal Opportunities Commission, would like to say more about, you know, awareness, first of all, and then, you know, we can provide, you know, some measures as to how somebody can protect himself and how he can survive economically, you know, in this during this pandemic. Indeed. I was telling you, because I had just touched only one vulnerable group, giving the examples of a person with disability. But you look at mothers. There's no way the child will get sick and then the mother doesn't attend to whatever. The young people, they are the ones who actually go for burials. I was told that, you know, there was somebody who actually died like 2 weeks ago, that those people who went, you know, the young people who rushed in to bury that person, some of them actually contracted the disease. And then, you know, they are telling us that we have, our immune system has to be strong. Then we have to have a good diet. But some people are so vulnerable that they cannot actually afford to buy the nutritious foods. Then there is some people who are vulnerable. They normally stay like here in the city centers. They stay in the slums, where there is inadequacy of water, where maybe they cannot afford soap, where they cannot afford, you know, social distancing, and, you know, the contacts between one another is very difficult. So these are the things we would like to say, that as much as you are in those circumstances, you must prevent yourself from catching the disease. Now, going on the economic part, majority of persons who are vulnerable, whom actually the Commission stands in to advocate for, they normally do petty businesses, especially like maybe if it is in the city center, on the streets of the towns, you know, in you know, small businesses. But now with this lockdown, they are hard hit. Indeed. Yeah, but you know, government is not leaving them behind. Yeah, because you very well know that the very first task force meeting we had on Sunday, the Right Honourable Prime Minister and all of us came up with strategies to actually go out and reach out to the vulnerable. And we decided that instead of giving food, this time we are going to give out money. Because, you know, you can never know. You can give posho when somebody wants to go to a clinic. Yeah, you can, you know, there's something like that. So
they can choose to go for healthcare or some food.
But our role now as Equal Opportunities Commission, and the cry, maybe the call we give out is that, you know, when we have a system, like now government has decided to give out the food, the money using the LC system, we are crying out to the LC system, the else one, kindly don't leave out the vulnerable people. There is a tendency, you know, people pretending not to know who is actually the most needy. So we are requesting that the LC ones are actually helpful to identify the most needy. There are also structures like the district task forces. Our recommendation is that the district task forces, where possible, they should include the vulnerable people on the district task forces. Before I became...
So that they identify their fellows.
Yes, yeah. And maybe when they are giving out any help, the representatives of the vulnerable can help to tell. And
this is a ghost beneficiary.
Yeah, I thank districts like Ruengo, Wikwe. Before I became chairperson, we had advocated for that and they actually accepted.
Indeed. But what about our people in the rural areas? We do know that most of this help is going to be targeting people who are in the ghetto slums, single mothers, taxi operators, border riders. But what about people in the far-flung rural areas? Are they vulnerable as well? Because the argument was they are largely engaged in agriculture and they have some kind of food. But we do know that 1.8 million traders or farmers might not go back to pre-pandemic economic levels. So they are grappling all the same. This group, isn't it vulnerable too?
You know, the pandemic has overstayed. It has overstayed. Indeed, I think maybe by this time we pray to God that it goes away. But you know, people in the rural areas, they are also vulnerable. They are also vulnerable people in the villages. In the first wave of the pandemic, these were the kind of issues. I have a lady friend in Iruero called Narongo Chaziki. She was telling me that, you know, the lockdown has come. I live in the town council of Ruelo, but my garden is outside of the town council. But because of my disability, I cannot reach out to the garden. You know, these are the kind of issues. I cannot reach out to the garden, and then there's no way, even if I can walk to the garden, then I cannot bring my food on the head.
I need
help. So basically, I need to have transport, like using a border. So these are the kind of issues. But now, you know, with the leadership of Right Honourable Prime Minister Nabanja, so many things are going to be brought. You know, when you are not faced with the situation, you may not know the detailed, you know, repercussions of that situation. But, you know, you asked a very good question about the economic status. This is something government has to actually, we have to sit down and think through. Yeah, because yesterday, as I was going for my prayers, I just imagined that, you know, Minister of Agriculture, for example, can come up and advise people, like during this, the 42 days of lockdown. You know, do you know that there are some crops which can grow in these 42 days?
Indeed, they are.
You know, you know them, like vegetables. You know, people can grow vegetables and then they can sell. But indeed, we need the technical advice of Minister of Trade, Minister of Agriculture. Because you remember, even in the first lockdown, I think the President came out together with the Minister of Trade to tell even the banks to reschedule the loans. Because people are actually doing business using money from loans. But, you know, actually, for me, what I'm saying, we can talk about the economics, we can talk about whatever, but we need to know the facts about this pandemic. Because, like, I would like to first of all thank the Ministry of Health. They have indeed, actually, they have struggled. But the facts are, the health system is constrained. Even the testing itself, yesterday I was reading some article from Professor Kalebu. He's saying that testing costs between 200 and 300,000. And you know, this is not a one-time of activity. You have to do it regularly. But then the best way is to live away from, you know, the circumstances which can lead you to catch the disease.
Do you think there is something government can do about this unfair pricing that we are seeing in many private healthcare facilities?
This is one way.
It can happen.
Yeah, it can happen, and I think you very well know that government has come in, especially, I think specifically in Wachiso district, the kits were provided, and the testing, I think, is free.
Because we do know an oxygen tank is now going for 800,000 Uganda shillings in a day. So 1.6 million for 2 oxygen tanks. Now you're talking about 200K to 300K for testing of COVID-19, all the way from 180,000. Unfair pricing. What can government
unfair pricing? Government is going to intervene. That's one I'm very sure. And even yesterday, when I was doing some reading, I even read about one health facility in Nigeria. You know, they are not hiking their prices. There are also doctors we know, like when you go to Entebbe Road, Seguku area, there's one Dr. Herbert who operates Stars Medical Clinic. You know, he's not charging those exorbitant prices, but he has treated so many COVID patients, and they have actually healed. Yeah, at least the hope we have is that, COVID heals. But then the other issue is also that, we are here now in the studios, assuming that everybody who is listening to us is actually getting the information. But we must also ensure that this information must be transcribed in accessible formats. I don't see, like, for example, sign language interpreter here. So we must be careful about even this awareness raising, that information is provided in accessible formats, and maybe in local languages. For us as the Equal Opportunities Commission, we are going to endeavor to do that, to give out information in accessible formats.
What about issues to do with funding? I mean, we're talking about vulnerable people. You talked about PWDs. PWDs number around 6 million people.
Yes.
So if we are saying all PWDs, at least 5 million of them are vulnerable, and then you increase other able-bodied people, couldn't you be having a number that is overblown to maybe 19 million people who are vulnerable? Do we have the funding? Do we have the money? Remember, we are talking about 21.9 million adults. How many are working? So meaning if many of them have been laid off, we're talking about some 19 to 20 million people who are out of work, or at least temporarily working. So what are we looking at? Do we have the money? Do we have the funding to cover all this vulnerable population?
I think this is a question which I cannot answer alone.
Indeed.
Because, even when we're in the task force, Minister of Finance, Minister of Local Government, the Office of the Right Honourable Prime Minister was tasked to look at the magnitude of the problem. There is also that subcommittee which looks at intersectoral issues. Yeah, we are looking at the magnitude of the problem, and then we see the kind of financial capacity we have, and then we see how to reach out, maybe in priority form, who is the most hit. Then maybe we deal with those ones first.
How will you be able to ascertain that person X is the most hit and person Y is vulnerable?
Of course, Minister of Gender is already doing that together with institutions like Equal Opportunities Commission.
So what challenges do you envisage to meet along the way as you expedite all these activities that are geared towards alleviating the suffering of the vulnerable? Challenges along the way?
Challenges, I think we enumerated those challenges, but we hope that all the challenges, like, for example, identifying...
The challenges in accessing this.
The challenges actually, on my part, there wouldn't be so many challenges. Because, for example, if we have got this decentralized system of governance, and we are starting at LC1 level, ideally, the chairperson of LC1 must be knowing the number of households in the village, and then the kind of households, maybe which has a person with disability, the female-headed households, the household which are maybe has so many orphans, or maybe the orphans are the heads, all the people.
Should we be targeting the family heads or all members of the family? Because we've been getting recommendations from some people who are saying, please do not target the father of the family alone. Target the mother, target the children, all of them, give them money. Because you do know how the men act. They can keep that money to themselves, maybe go to a bar somewhere that is operating illegally and spend all that money.
I think all those dynamics are being considered when we are planning to reach out to the households. But we have an experience even with the first wave, whereby things were given and then some got, some didn't get. All those fine details are going to be dealt with. But we hope that the leadership of the Local Government Council 1 must be very helpful to ensure that everybody is reached.
We also do know that government is targeting single mothers, yet we also do know that there are women who do not have children but are largely grappling all the same, especially those in the agricultural sector. 1.8 million traders actually we are being told that they might not go back to pre-pandemic economic levels by 2023. Not even 2021 will be able to help them get back on their feet, even 2022, up to the next 2 years. So shouldn't we be increasing the scope of who is vulnerable here?
Like I told you that in the last task force meeting, I told my colleagues in the meeting that I'm learning that the concept of vulnerability
keeps on evolving.
It's an evolving concept. But we have been using these terminologies. We shouldn't forget what we are learning. We should just master what we are learning. Living in a new norm. Yesterday I was watching a certain video, and somebody was saying that, the pandemic is not going to leave us the way we have been. So many things are going to change. you know, I don't want to say, to mention that, you know, there are some professionals who may not have jobs after the pandemic. But, you know, there are certain professionals, professions which will actually be more wanted than, for example, if you are trained as a health personnel, you will be needed. If you are trained in IT, you will be needed. But there are certain people who will actually be like getting out of the working sector or the money economy. But I think what we have to do is to be vigilant also. We should be vigilant to see what is transpiring, and we move with what actually is applicable.
All right. Also, there is also this about inflation. Do you have economic experts who are saying if you give out money to individuals within the family settings, it will lead to inflation of food prices? Yeah. Was this actually also put into consideration?
Yes, but this is common knowledge. Even some people, some economics normally tell us that you cannot just get money. Is not just, you know. You cannot, it's not good to get money which you have not worked for. You must earn when you have actually worked for the money. But in circumstances, if we are hit by a pandemic like this one, I think certain things have to happen, because you cannot say that, you know, because somebody may die if you don't give him the food. Yeah.
Go ahead.
Okay, I thought that maybe, no, I was saying that, you know, the economists will help us to see how we can actually deal with this, because even government is struggling to see that they get money to give out to the people, because this was not in the original plans as much as we have been with the pandemic. Yeah, but these are things which come and we have to deal with them.
And of course we didn't plan for any of this, because out of the 44.7 trillion budget, it was passed even before this second lockdown, meaning money for these shocks was not actually prepared for.
Yeah, but we have to get it.
Indeed, and we have to get it. That's why we're asking, where is the funding going to be coming from? So just ideally give us your last parting shots, Honorable Nalule, as we move forward. Recommendations to the government as we move forward, what they should be doing.
I think government should endeavor to actually, as I said that I'm coming from Equal Opportunities Commission, a commission which actually is targeting to reach out to the vulnerable, to ensure that government reaches out to the vulnerable. And we are doing this with other stakeholders like Minister of Gender, our Mother Ministry. I think the government should actually bring in much more money and much more, maybe as we plan, and other items which can actually help to reach out to the vulnerable, so that first of all they don't get they don't get the virus, and they get those materials which actually can help them to stay alive.
All right.
Like, you know, the charges for water, National Water and Storage Corporation should actually help not to disconnect water. Institutions like international agencies like UNICEF, World Health Organization, UN Women, and others.
So government should work with other partners in helping alleviate the suffering of the vulnerable people in Uganda. Thank you very much, Honorable Sophia Nalole Juko, the chairperson of the Equal Opportunities Commission. She has a wealth of information. Let's also bring in Ivan Walonyola, our correspondent.